Electrical burns and management. So definition: electrical injury is the damage to the skin, so internal organs, which when a person comes to the direct contact or electrical current. Okay, so determine the electrical injury means type of circuit, then the resistance of the tissue, amperage, voltage, current pathway, duration, environment factors, and individual susceptibilities. Then body tissue decision. List means nervous, blood, mucous membrane, muscle, dry skin, tendon, fat, and bone. Okay. So management. So ATLC protocol. ATLC means first airway maintenance, then breathing and ventilation, circulation, hemorrhage control, disability means neurological status, then exposure and environment control. So restitution means the burn restitution formula based on the surface area burned to inoccur. So maybe hemoglobin, then resistance maintained to normal vital signs, urine output 30 to 50 ml, so we can give ringer lactate. Then mycloglobin means presence of pigmented to darker than light pink urine means myoglobin or hemoglobin pigment will be there means that diuretics and all they can give. So loop diuretics is not efficient to mannitol. Okay. Then urine output and all they will maintain the IO chart to reduction of the any urine output and all we can see. So 2 ample mannitol is a 25 gram to IV bolus they can give. So sodium bicarb they give. So ringer related to administration followed by to urine pigment. Then electrocardiographic monitoring. So document the cardiac arrest. Then cardiac arrhythmic under transport of ER. Then abnormal EKG. Okay, sinus or bradycardia. So burn size of the patient to monitoring. The most common abnormal is ECG. So tachycardia or bradycardia, anything is there, or ST or TBA, the changes will be there. So some creatinine kinase maybe levels to poor will be there. So absence of ECG. Okay, then wound care, cleaning the wound with the saline or soap water. Then chloroxetine for 0.1 percentage. Then local burn care form with the sulfamylene. Then thick containing excellent penetration they will use. Silver sulfoxide they use to micro control. Then deep flash and flame components to biological dressing used for superficial and elevation to limit swelling. So surgical excision means begin 2 to 3 days post born. So obviously narcotic tissue to remove necrotic tissue they removed. So it's elevated to every 2 or 3 days they will wound closer. So conservative causes is the tissue removal and wound closer combination of the skin graft they can do or flaps will be done. So physical therapy and functional sprinting and all then ongoing process. So electrical injury it's a wound management. It's a true high tension, sharply demarcated, then always full thickness and lethargy appearance will be there. So this is the scalp injuries, scalp burn injuries, then chest wall injuries. So thoracic injury to the deep structure of the penetrate nerve. So thermal injury to the heart will be happen. So present the special closer to problem means the bone and cartilage are all visible. So then most frequent complication means deep chest wall burn will be there. Then abdominal wounds mean internal injuries both directly under contact. The points and remotely to result the late ischemic necrosis. The patient must be frequently evaluated for the changes of the abdominal examination or feeding tolerance, deterioration of the laparotomy and repair the large abdominal wall wounds. Then oral cavity. Sorry, younger children, oral consumer initially treated to conservative. The most serious complication bleeding from the labial artery 10 to 14 days after injury will be there. So what is the wound management? Frequent involvement of the hand, then exert point one or both legs, then RC injury to the distal forearm axillus. So here that compartment syndrome means first 48 hours post injury that high voltage injuries is damage to the muscles and swelling with the investing fascia to extremities. So lost the pulse to one of the lost sign. So serial examination is the extremities to repeated measurement of the compartment pressure will be we can give. So we can give the fascinotomies. So clinical investigation of the compartment syndrome and progressive nerve dysfunction, then failure of resuscitation of the patient under exploration, then wound deferment and all third and fourth postborn day. Then prevention and electrical instrument, do's and do nots, electrical safety, house should be checked to ensure the wired correctly. Wait, some signals there may be problems inadequate bearing, how to electrical codes that misused. So what is the some safety principles regarding to the electrical equipment precaution after doors? Okay. So then injury of prevention of lightning. So if you are outside, whatever you come safety measure, don't stand under the natural lightning. Then tall tree in the open isolated area, avoid projecting from the surrounding landscape, then open field and you'll stop and all. Get out away from the open water, then get from the tractor to other metal from the equipment. So this is the normal electrical burn regarding the classes. Thank you guys.